Okay, so this is a training about the CHW qualifications and training that's in alignment with the policies and the requirements of the CHW benefit for the Department of Healthcare Services. I'm going to skip through these kind of intro slides here. I think we all understand why we're here. It's mainly to provide community-centered capacity building for the grantees of the LGBTQ TA Center. Want to thank all the grantees for their engagement. So we completed a few trainings today. We've done a Medi-Cal 101. We've reviewed the CHW Benefit 101. Recently, Amber, you may recall, we like last month, we went through contracting and credentialing, and it sounds like you're making amazing progress with PAVE. And I think the next step after that would be MCP readiness and kind of pursuing their kind of contracting opportunities. Right now, we're at module 2. Today, we're going to cover CHW qualifications. And in the future, we're going to talk about the rest of these modules related to referral and outreach kind of documentation for policies and procedures and billing and claims coordination management and things like that. So this is just a preview for the future kind of modules and trainings that were tailored for this group. Um, so today we're going to be describing the core competencies and the training requirements for the CHW workforce. We will also be kind of sharing a customized template, I think, for Amber, your team, and anyone else who's listening to this recording, to help track your own kind of workforce training progress, whether you have CHWs or similar roles as CHWs. And there's also a way to measure competency level and to identify key gaps. And then we're also going to talk about how we can identify practical strategies for strengthening or developing sustainable training opportunities. So how does this sound to you, Amber, kind of about these objectives? Do you feel like this would be helpful in terms of advancing?
Yeah, definitely.
Okay, great. Awesome. Great.
Just to know, I'm specifically interested in the training plan just because I need a very widespread training plan because I'm talking about, 30 people that I'd like to get trained somehow at the same time. So just to know,
Mm,
that's where I'm like, okay, great. I'm going to pay really close attention when we get to, well, I mean, I'll pay close attention the whole time, but that part is where I'm really like, I've reached out to a couple providers and they're like, no, we can't do it. So interested in
yeah.
hearing your strategies on that one.
Yeah. And I think we can actually jump to that section because if you want to, I mean, something that we talk about a lot is how we build sustainable CHW training programs, especially if you want to have a kind of a workforce-wide kind of training opportunity. And so we have some tips, I think, based on what we've learned regarding CHW training programs. And we're learning this from, and I skipped to this section, like objective number 3, to more immediately kind of jump into that conversation around that topic you just brought up. These are some recommendations by a national C3 council that it's a national organization, an entity that kind of is responsible for developing CHW core competencies. There's 11 core competency areas, and that's what DHCS and California is abiding by. They're following those core competencies very, that's the requirement for CHW certification and to qualify for delivering the Medi-Cal services. And we've also referenced some other sources, like the National Association of Community Health Workers. And when developing a training program, we do encourage mapping your current workforce roles to those competencies, which we'll review after this section, and identify those training gaps. I think once you kind of conduct that crosswalk, if you will, what your organization currently has, and maybe some of your trainers, external kind of trainers, like trainers external to your organization or training partners or organizations. You can kind of identify those training gaps. You might want to think about, when you're engaging with a group of 30 plus people, or even smaller or larger, thinking about how you want to mix up your methods to make sure that the trainings are accessible. So these could, look like workshops, online learning, there's on-the-job coaching, there's peer mentoring, there's so many different ways of training, your workforce. Um, and then you mentioned partners. So there's so many different types of training programs out there, whether they're hosted by community colleges or local health systems. There are dedicated CHW training organizations. Sometimes your own local managed care plan can offer a training program directly, or they can sponsor with some dollars a CHW training. And so there could be a sponsorship, or you might share some costs, and that way you can access quality curricula. Um, I think when you become a provider and you generate revenue in any kind of Medi-Cal stream, you could, or for any Medi-Cal benefit, whether it's CHM benefit or enhanced care management or community supports and other benefits, you could utilize the revenue and other grants, and maybe your own organization can use its own dollars to fund these training programs. And some other kind of recommendations include ensuring that you have supervisor capacity. So training supervisors to mentor and coach and model these competencies. So thinking about that one or two all-star supervisor who can kind of deliver quality trainings. And lastly, um, thinking about the training crosswalk tool, which we'll show after this, to continuously monitor competency gaps and adjust them on an annual basis, so that you're up to date on the kind of the training needs, and you're allocating your resources wisely. So I'll pause there. These are just kind of high level tips, but curious if any of these like speak to you, or any specific questions you might have around training capacity. Yeah.
Yeah, I'd just be interested in some of the partners that you can identify because, you
Mm-hmm.
know, the junior colleges, so I cover Napa and Sonoma, and so the junior colleges in both have the trainings, but it's go at your own pace. And I feel like my staff will do a lot better in a cohort model. So I have reached out to partnership. I have reached out and here, Aliotos is the guys that were doing some of the trainings, but they don't have any scheduled. So I just haven't, and I just haven't been able to find a trainer where, and I needed, of course, in English and Spanish, right? And so I haven't been able to find a trainer yet that can do it in-house, in dual languages and at a pace that I think is going to work for my staff. Because, the staff that they're paraprofessionals and, some of them don't speak any English. And so I just want to
Hmm.
make sure that I'm tailoring something that's going to actually be, impactful and effective to them. So, and then I will say just one thing to note. I just thought it was interesting. It just came up in a meeting I was in Sonoma County where there's a lot of different, or there was a lot of CHW trainings. I think a lot of them have kind of come and finished, but um this like idea of an inequity among trainings came up, which I thought was really interesting. So like those individuals that were able to take time off work and go to the Santa Rosa Junior College training that was sponsored by the county and, got compensated for it, they tend to be higher regarded than some of the CHWs that went through some of the like community-based training. So it was a kind of like a monologue by one of the CHWs that was frustrated with that. But I just thought that was a really interesting piece to consider. And so that's another consideration for me as I'm choosing a partner is to like make sure that when I say yes and we were trained by X, Y, and Z, it's an entity where especially the county, right, is who I'm really concerned with at this point. I mean, partnership I think is fine with whoever you choose, but that's going to be like, oh yeah, well that's valid and now we trust them and all that kind of stuff. So that's my partner selection is where I'm where I'm challenged at this exact moment.
Got it. That's really helpful to hear. Yeah, there are, and we can maybe do deeper dive, Amber, in terms of just looking at your region and also just across the state, right? In terms of which training programs we can identify that's the right fit. The notion that there are inequities in terms of specific training programs that are more quote unquote highly regarded, those inequities definitely exist. We have done a statewide scan of all the training programs, and we find that different types of training programs exist, whether they're hosted by a community-based organization like Aliados Health, for example, um, or there are more kind of uh, employer focused organizations. Like sometimes, I think you mentioned the county, right? The county has some kind of, are they sponsoring the training or are they delivering the training? Did you mention?
In Sonoma County, they delivered a training module, but they don't have another one. And in Napa County, they're just sponsoring it.
Got it. Got it. Okay. So sometimes, yeah, counties, the public health agencies, they might have um very kind of one time or ad hoc kind of like training offerings. And then we also have another type of organization that typically um, delivers training or academic organizations. So like you said earlier, the junior colleges, right, that are local. And it sounds like they offer more modular training, but not like a cohort-based training, right?
Right.
Got it. So we can do a deeper dive on this, Amber, maybe at a separate call, but something that you've already called out some like structural kind of so if you were to develop a criteria, for example, and welcome Andrea. Thank you so much for joining us. Um, hopefully you're able to hear us. Are you able to hear me okay?
Hi, yes. Sorry, I'm late. I'm just trying to figure out my tech here. Hi, everyone.
Hi, no worries, no worries. Thanks so much for joining us. We're talking about CHW training programs.
I see.
Yeah. So some of the criteria, Amber, to consider is one, what is the best kind of structure for your workforce? So, for example, you mentioned we need a cohort-based program that's going to help our kind of workforce kind of thrive in learning. So that will help narrow down. You'll kind of eliminate all the non-cohort-based kind of training. And also, you also mentioned language access. So there are programs, not a lot, but there are programs out there that offer that deliver the trainings in Spanish and other languages. Would you say Spanish is a priority kind of
Yeah.
language? Okay,
Yeah.
great. And then there are also opportunities where you might want to consider the time commitment too. So some training programs, I mean, they can be as little as 80 hours for an entire kind of training program that covers all the core competencies. They can be as much as like 300 or 400 hours. It's kind of the range is quite large. And so something to consider is how much time is going to be required for your workforce to kind of fulfill all the trainings. Now, a step before kind of enrolling everyone into a training program is to assess those competencies first. And, does your entire workforce need to participate in a training that covers all 11 core competencies? Or could they acquire, uh, specific, like competency specific training? Say, for example, and I'll show an example here in just a moment. Let's see. Like these are the 11 core competencies. And so would your, say, some of your workforce already have maybe proof that they have been trained or they have proficiency in communication, for example, but maybe they might lack number 11, basic knowledge in public health principles and social determinants of health. So you can almost kind of look at your workforce. You can enroll all of them to go through a training program to cover all 11, right? Just to be like sure. But you can also maybe think about which of your workforce might need just specific trainings, and those are easier to find. Say, for example, with communication, I'm going to go to this kind of descriptor, and I'll share this slide with this deck with everyone after the call. As long as a training program or a training like opportunity, it could be a 1 hour webinar, can cover, right, these elements, these sub skills in this kind of particular competency area. And they receive, right, proof that that they've completed the training. It doesn't necessarily have to be a certificate that's issued by a specific organization. It could be any organization. So there's a lot of flexibility here in terms of whether it could be on the move. On the move provides this training, and they can issue a certificate of completion. It could be your local junior college if they have a class on just communication, or if there's like a workshop out there in the community hosted by Aliados or Partnership Health Plan. They can, essentially cover kind of this maybe missing competency, if you will. So those are just some ideas. So just to summarize, starting with the criteria, what are your absolute requirements for a training program? And then starting from there, and then maybe Amber, we can work together to kind of build that criteria, and then check for programs across the state. It's almost like there's no like common directory of all the training programs for CHWs. We kind of have to kind of ask around. It's more like word of mouth, and depending on what program is funded these days, we kind of have to search on our own. But I'm confident that we can get to a place where we find the right training program for your workforce.
Cool. Yeah. I think I appreciate what you said. I gotta think a little bit more. It's like appealing to be like, oh, can I just buy the box with all of the modules, right? But I
Mm.
think it's interesting to think about like tailoring something based on individual needs, and because like we just went through this whole org-wide motivational interviewing training, right? So like
Hmm.
sure there's a bunch of pieces in there that obviously flow over. So like what would it look like to kind of pick and choose different modules is an interesting concept for me to noodle on.
Yeah, and that's competency area number two, interpersonal relationship building. There's a sub-skill, C, using interviewing techniques like motivational interviewing. You can, if you already went through a motivational interviewing training, um, where maybe it encompassed all these other kind of areas too, right? Like how to provide coaching for a client or a patient, practicing cultural humility. On the move can provide that certificate of completion, date it and be like, oh, this is, for the next 1 year, this person is trained. So essentially then, if your whole organization went through this, then really you're just kind of boom, you've already covered one of 11. So you just have 10 competencies. It's a little bit more work, right? Kind of to kind of piece together. And speaking of that, actually, I'll provide this template for you and for Andrea too. Um, Here's kind of a very simple kind of sample template in terms of assessing, CHW performance in any of the core competencies. So, are you developing this core competency? Is it satisfactory? Is it proficient? And we'll share this a more formal tool. I know this is just in slide format. Here is also a sample template for a training crosswalk. So this is where I would probably work one-on-one with you, Amber, and for Andrea, if you're interested. What's the training topic that they received? Say it's motivational interviewing. Who's their training entity, right? and what competencies do they cover. So it's kind of like bingo, right? If you cover all 11 core competencies here, then you have the kind of documentation and the you'll be prepared for an audit by the department, to see if you've met the CHW qualification kind of requirements.
Yeah, that's interesting.
Great. Andrea, I just jumped in and curious, we're just talking about, the ideal training programs out there for community health workers and people who function and as community health workers and deliver kind of community health worker type services. For SFCHC, I'm curious, do you have any in-house training programs or any programs that you all partner with externally outside of the community health center?
That's a great question. I'm new to SFCHC. What I know is we have internal trainings, uh, but not like some of that cover some of these competencies, but not necessarily specific to CHW. And then we've been providing CHW services, but this year we're entering or we're looking at entering CHW as a Medi-Cal benefit. So this is why um, it's great for me to be in this group and to learn more about the program.
Great, great. Thanks, Andrea. Um, uh, I totally understand, given your positionality right now, being newer to the work, but maybe we can set up a one-on-one call after this, and would love to help navigate SFCHC's journey for CHW services. For the CHW benefit, I'll just be clear and upfront. Federally qualified health centers like SFCHC unfortunately are not qualified to become a CHW benefit provider. However, there are other pathways for SFCHC to become a Medi-Cal provider through other Medi-Cal benefits like enhanced care management and community supports, where your community health workers could function in those areas, but not the CHW benefit, unfortunately. And that has to do with the financial arrangement that FQHCs have currently, given that they're paid right on PPS, and that's already inclusive of CHW services. Which is there's a big all FQHCs are upset across California around this. However, there are some not workarounds necessarily, but still opportunities for community health workers to bill for specific services like enhanced care management and community support. So all this should still be relevant for your organization.
Yeah, thanks for that, Joe. Actually, we we're entering that space by contracting with MCPs because from our understanding, that's really the only way that FQHCs can take advantage of this program. And right now, we're already in communication with SFHP and Anthem since we provide ECM with them.
Oh, great. Awesome. So it sounds like you're already an enhanced care management provider for Anthem and SF Health Plan.
Yes.
Great. Awesome. That's perfect. That's perfect. And I hope they'll provide not all MCPs accurately relay this because I think they're also are interpreting policies and the best they can. Um, and so from a yeah, just for the CHW services, this is characterized as a fee for service benefit, and with the FQHC's PPS reimbursement model, the prospective payment system reimbursement model, that's designed to cover the average cost of allowable Medi-Cal services, including CHW services. So that's why FQs can't bill an additional separate CHW claim on top of their PPS payment. So that's something that's just good to know. But in terms of um, there is an opportunity, I think, for FQHCs to incorporate CHB costs into their PPS rate. There's this thing called initial rate setting or change in scope request. But it's a very long administrative process, but I'm happy to talk to you about that separately. Um, but you can also receive, through Anthem and SF Health Plan, receive CHW payments through other, like enhanced care management, for example. I would encourage you to look at community supports. Community supports is also another area, Medi-Cal benefit. And sometimes you can also still talk to your managed care plan to see if they can help sponsor and for related to this topic, CHW training to prepare your CHW workforce. Even though you can't do the CHW benefit, they can still they still have money to provide resources for training.
That's great information, Joe. And maybe yeah, you're correct. We could set another meeting just for us and our team just to understand whether or not our FQHCs can benefit from this program because we did our initial research and we thought that working with the MCP is a route that we can provide participate in the program, but it seems like what you're saying is it's actually much more complicated than what we had thought.
Yeah. It's a very common disappointment by FQHCs. But there are still opportunities. Uh, let's see. Yeah, I'm reading through this one policy section. For Medicare, if you serve older kind of populations, there's an opportunity there too. So let's definitely talk online offline more about this. So I'm excited. I love SFCHC's work, and so there are many pathways for sustainability. Okay. So Amber, you learned something new too, I hope, as a community-based organization. So I know you work with Aliados Health. Aliados Health is a consortium that represents a lot of FQHCs. So you might see Aliados Health function as a community-based organization that qualifies for CHW service, CHW benefit. So that's like not a workaround per se, but it's one way where Amber, say you work with FQHCs locally and they want to build up their CHW workforce, they could go to Aliados Health, for example, to see if they could be a provider where they can place their employed CHWs within FQHCs. And that reminds me, Andrea, San Francisco Community Clinic Consortium, um, SFCCC, they're your regional association in San Francisco. And so I'm curious, there might be an opportunity for them to become a CHW benefit provider as a community-based organization, and they can place their CHWs into FQHC settings, including SFCHC. That's a model that has been, that's a model that's emerging. So little creative things here and there. Okay, well, I'm gonna so we I know we jumped around a little bit, but this is our training style where we immediately answer questions and address curiosities. But I'm gonna kind of go back to the basics here because I think for Amber and Andrea, this is just really good to know in general, for not just CHW benefit, but other related policies. So and Andrea, one more thing I wanted to cover with you is I'm actually talking to another FQHC in another part of the state where they have kind of like a separate operating like entity, if you will, like fiscally sponsored by the FQHC. So we're looking into whether that separate entity that's a nonprofit could be a CHW benefit provider. So for you, Andrea, in your case, SFCHC may not be this, they cannot be a CHW benefit provider, but if you had another entity associated with SFCHC, could they become a CHW benefit provider? So that's also another pathway that we can look into. Um, so um, so say, so uh, for the CHW benefit providers, for your CHW workforce, these are the requirements. Medi-Cal has two of the following pathways for CHWs to demonstrate minimum qualifications. So that's through in the teal here on the left side, the CHW certificate pathway. And there's also the work experience pathway. So we do want to note that the CHW certificate can be issued by any entity. On the Move can issue it, SFCHC can issue it, Aliados, Partnership Health Plan, SF Health Plan, Anthem, LGBTQ TA Center. I just to come to think of it, Alex, if you all have trainings that you delivered that align with the core competencies, you could be the training entity that provides these certificates of completion, right? And shares it with like Amber and Andrea and others. And so it could be any organization because the state of California does not have a state-sponsored certificate kind of process. And there's this other thing called a violence prevention professional certificate. So for if Amber and Andrea, if your CHWs provide um, violence prevention services, you can seek violence prevention certificate through two organizations. They're called Health Alliance for Violence Intervention, or they can get a certificate of completion in gang intervention training from the Urban Peace Institute. So I'll just drop that information into the chat box in case you're interested in looking into those organizations. So those are the state recognized entities. Not sure how they became state recognized entities, but those are the two. Um, and then the work experience pathways. So if any of your CHWs have 2,000 hours of experience in paid or volunteer positions within the previous 3 years, then they can qualify to become a CHW to deliver these services. Um, but a CHW who does not have a certificate of completion, even without work experience, they must earn a certificate within 18 months of the first CHW visit. So say I'm a CHW, say like Andrea hired me. I qualify as a CHW because I bring 2,000 hours of experience. After I see Joanne as my Medi-Cal member beneficiary, but the moment I see her today, 18 months from today, I have to secure a certificate from trainer Amber and another trainer, Alex, to fulfill my competencies. And then every year, CHWs must complete a minimum of 6 hours of additional training annually. And then the supervising provider has to maintain evidence of his continuing education. Okay. So despite the gossip and the common kind of, misunderstanding, Medi-Cal in California, they don't require a CHIP certificate to be issued by DHCS, by HCI, or any state organization. Once again, this can be issued by any organization in California, even by another state or international. So, Amber, I know you asked about training programs. It doesn't have to be, I know you are looking for cohort-based trainings. If it's in person, we'll have to narrow down our options to the limited number of in-person programs, but there are a lot of virtual kind of training programs out there too. You instantly expand your options when you look beyond California. And so there are some virtual cohort-based programs that can offer these kind of trainings. Um, and yeah, and the curricula, as I mentioned earlier, it has to align with these 11 core competencies. So these core competencies were developed by the National C3 Council, and these are the skills that your organization needs to demonstrate as adequate training for CHWs to be able to perform CHW services. And I'm going to go through not all of these skills, right? There's a lot. You'll receive a deck with these 11 kind of skills, but you'll notice in each of these competencies there are sub skills, like for communication skills, for example, how to communicate using plain and clear language. Things like interpersonal, interpersonal relationship building, how to manage conflict. And then lastly, not to go through all, this is my last example, for service coordination and navigation, how can your CHWs coordinate care, and help, clients and patients access resources and overcome barriers, and do follow-up and track care and track referral outcomes. So these are the very specific kind of skills that hopefully your training program, whether you house it inside your organization or when you partner, these are the skills that you really want to ensure your CHWs learn. Now, I'm going to kind of tie it all together for you all because I know in the last conversations we had, we talked about the four billable kind of CHW services, and health navigation is one of them. So, for example, if your CHW is providing information, training, referrals, or any kind of support to assist Medi-Cal members with accessing healthcare and connecting to community resources, this is tied to, say, the skill that I just mentioned, service coordination and managing, which includes coordinating care, including identifying and accessing resources and overcoming barriers. In the dark blue box at the bottom here, our team did some research and we looked through your websites and we just kind of pulled some example services here. So Amber, you're LGBTQ connection, right? So referrals to LGBTQ friendly therapists could be counted as health navigation as a billable service, and why service coordination navigation as a skill would be important. And Andrea, it seems like you have a gender supportive housing services that's offered through the Taimon Bhutan Navigation Center. I could be mispronouncing that.
Taman Bhutan, yeah.
Taimon Bhutan. And so that's also an example of providing service navigation. And so, and I listed all your fellow kind of grantees in this cohort, other kind of services that might count as, health navigation. So I'll pause here. I know I just provided a lot of information for Andrea and Amber. Any kind of thoughts, initial thoughts, or questions that arise for you as we just for at this point of the training?
I think I was just thinking while you were talking, something that would be super helpful, and I'm not sure if it exists, is like some kind of crosswalk between existing job functions and then the various positions that are Medi-Cal fundable. Because I'm just sitting here thinking, like, for LGBTQ connection is this in particular is one I've really struggled with trying to figure out. Like, does it make the most sense for them to become CHWs because they are doing health navigation? Does it make more sense for me to try to get them certified as certified wellness coaches because a lot of their work does happen on the school sites, right? And then one of our other programs, we're getting certified peer support specialists because it's, focused on the behavioral health side of things. And so it's interesting to think about what it would look like to kind of think about how to look at what's billable under the different positions and then try to figure out which one kind of maximizes not profit, but maximizes billing so that you're like opting for the right position, because there are similar, and I mean there's a lot of similarities that kind of hit on all three. And so I'm just as I'm thinking, I'm wondering which one would be best for my particular staff given the roles with their CDEP and that's early intervention and blah blah, all that kind of stuff. So that's just a thought that I was having while you were talking.
Right. I think that's a really great yeah, I think there are a lot of intersections between all the billable kind of positions, right, under Medi-Cal. And so you called out the CHW benefit, you have the peer support specialists, um, you have the wellness coaches right through HCI. So let me just actually pull up something because I know I did this crosswalk with another team member. Um, let's see. Uh, yeah, I can't find the file right now, but I know I did this like I drew like this visual diagram at one point where it kind of like maps out all the different types of workforce. But yeah, I think as a CBO, Amber, I think if you um once you go into contracting, you might want to there's a lot of similarities in terms of like enrollment and contracting is pretty straightforward. It's a very common there's a common kind of procedure for every Medi-Cal managed care plan. And generally all these positions that you mentioned, like the CHWs and peer support specialists and wellness coaches, I mean, they're all really focused on prevention, kind of non-clinical, like whole person care. And they all require some kind of documentation, right? And they have all these billing standards. And so, for peer support services, that's specifically under specialty mental health, right, and substance use disorder systems. So if you have a workforce that kind of specialize more in that area, it might make sense, right, to kind of pursue that area. For the certified wellness coaches, that's under the Children and Youth Behavioral Health Initiative, and they're usually for like school linked and school based organizations. But there's some kind of non-clinical like youth like behavioral health support that if some of your workforce does that work, that could be an opportunity there too. Um, and let's see. Yeah, and the contracting is different where for like CHW, yeah, services you would contract with Medi-Cal managed care plans. For peer support specialists, you would typically contract with a county behavioral health plan. And for wellness coaches, you would have to participate as a school-linked or school-based employer. So not only would you crosswalk which part of your workforce would align with these different positions, but you would probably maybe consider mapping out, okay, these are the partners that I need to contract with formally, and they might have, these different kind of training requirements. So yeah, I think crosswalking that would be and what you can realistically bill, and one way to kind of frame that is like how do you I mean, quite frankly, it's like which path might generate the most kind of revenue to help pay for right the personnel and the non-personnel costs associated right with your workforce and the programs that you run. And so optimizing that would be really interesting to kind of map out. So yeah, great thought there. And then Andrea, I know for FQHCs it's a little different, but I think does SFCHC have a school-based kind of or school linked or school-based kind of location? I'm curious.
I don't believe so.
Okay.
You mean do we work with the school to for our workforce development? Is that what you're saying?
Oh, I'm just curious if you have like a school-based health center or do
Oh,
you
no.
offer okay, got it. Um yeah, because I think to Amber's point, for under HCI FQHCs would be eligible to hire kind of certified wellness coaches. Um, so in case SFCHC currently serves, or maybe in this future serves kind of youth, kind of ages through, I think, 25, I think, then you could, potentially leverage the HCI Wellness Coach program. So it's another opportunity. There are lots of opportunities. Okay. So earlier we went through the training crosswalk exercise, but before I wanted to show that, I mean, this is something that here are some guiding principles recommended by the C3 Council. Um, and something that, as you know, for both of you, Amber and Andrea, as you think about skills assessment for your CHWs, I think really assessing um, developing this assessment with your workforce could be really a helpful opportunity to improve or strengthen your skills assessment approach. So it's a form of practicing cultural humility when you're hearing from the voices of your CHWs in your workforce, what they feel might be appropriate to assess for. There's this life cycle approach. Excuse me, my office acting up. Um, there's this life cycle approach where you could assess your workforce at hiring, onboarding, and on an ongoing basis. So this aligns with the continuous kind of competency checks. We do recommend that a lot of folks, for providers to encourage CHWs to assess themselves and their peers and the work environment. This is an equitable way of incorporating the CHW voice. And there's also an opportunity to seek input from the community served by CHWs. That's another well-rounded approach to assessing the competency of your CHWs. And there's also, supervisors are so critical. They kind of, as we all know, make or break, right? Workforce experience. And so training your supervisors and supervisor training beyond the competencies and allowing CHWs to assess your supervisors is a very highly recommended approach. We covered this right here, right? Like the rubric for assessing CHW performance. And we covered this, right? The training crosswalk. And at the top of the call, thanks to Amber's great question, we already covered this section around sustainable training programs, just like criteria to look for. These are just some high-level tips on how we might build out internally or externally a training program. And I did have some thoughtful discussion questions here, but I don't think we have time to cover these, given that we're at the top of the call. And we're going to close with an evaluation. So if you can please kindly click on the evaluation link and have this open on your browser. And your responses would be greatly helpful for us to evaluate the quality of today's training and also an opportunity to seek feedback for future trainings. And that concludes our training.